So welcome to our virtual town hall series. It's just 6:31, so again, there might be people logging on as we get started. But one of the things I'm kind of a stickler about is starting on time and respecting everybody's time. So I want to welcome you to our first in a series, a virtual town hall series on public health and racial justice. This is part one, COVID, police, and protest. I'm Barbara Lee Van Horsen. I'm the experimenter at the Momentum Center, which is a grassroots movement to create a stigma-free community. And one of the things we do is we lead the Mental Illness Task Force. The Mental Illness Task Force is who organizes these town hall meetings. But this time we are joined, and we're really excited about this collaborative town hall with the Human Relations Commission of the City of Grand Haven and Loudet Library. Do want to acknowledge our sponsors. We do have sponsors regularly for our town halls, and we're very grateful to Ottawa County, the City of Grand Haven, North Ottawa Community Health System, and Grand Haven Area Public Schools. Now we haven't had, again, HRC and Loudet are new to being collaborative partners in this. So I wanted to give Luann a moment from the Human Relations Commission to introduce herself and the work of the commission. Luann?
Thanks, Barb. I'm Luann Worksma, a resident of Grand Haven and chair of the Grand Haven Human Relations Commission. We are a board consisting of 9 citizens of the City of Grand Haven appointed by the mayor, and our mission is to encourage sensitivity and promote understanding among people, regardless of their race, background, faith, creed, gender, sexual orientation, age, or disability, with the being equal treatment for all. As a co-sponsor of this town hall, we're grateful for your participation and engagement in this important topic, the entire community to join us in this work. We look forward to hearing what you have to say, and we'll review your feedback in order to explore and determine our own action steps. Thank you for joining us in this critical community conversation, which is just about to begin. Barbara, to you.
Thank you, Luann. We also have a wonderful set of panelists joining us today. Julia Rupp is with us from Health West. Derek Chia, am I pronouncing that right, Derek? All right, from Ottawa County Department. Steve Kempker from the Sheriff's Office, and Jeff Hawk from Grand Haven Public Safety, and Brett Van Tol from Pine Rest. And I'll speak to each of those people and the roles that they play in a moment. First, I want to just go over the town hall agenda. For those of you who have not participated in one of our town halls before, it is a different format than you might be used to when it comes to town halls. It isn't just about listening to people on the panel or having them talk to each other. It really is a community conversation. So we invite our panelists to provide some background and context, but also to field questions that people might have for them. And then we go into the community conversation, and our panelists are part of that. So they'll be part of those small breakout rooms. But that'll be a big part of what we do. We'll do this welcome, instructions. I'm gonna have a few polling questions to start. Then you'll hear from the panelists. They'll each have 10 minutes, and then we'll have a question and answer period. That will follow that with those breakout sessions. So the first half is more presentation. The second half is really grassroots community conversation. And then we'll have some final polling and talk about next steps. So in terms of instructions, please keep your microphones on mute unless you're called on to speak. And when we do report out, I'll ask each panelist or each facilitator to report out. We ask that you submit your questions or comments in the chat box. There were questions that came in ahead of time, and we did distribute those to the panelists. But if you have questions as we go along, please put those in the chat box, and we will get to as many of those as we can. If we don't get to all of them, we will follow up and get those answers to all of the participants. To participate in the breakout sessions, you do need to have the Zoom app. So if you're logging on through the web portal, you won't be able to participate in the breakout sessions. I would encourage you to download that app so that you can be part of that conversation. Because again, this really is about a grassroots conversation and not just hearing from particular people in the community. In terms of next steps, we are recording the town hall. We'll make that recording available to all of the participants. We'll also send any resources or references that come up, slides that are used, we can send those out. We'll send a whole packet. And then the Mental Illness Task Force, Loudoun Library, and HRC are meeting again tomorrow to debrief this meeting and to plan next steps based on your feedback. Next thing, we always go over our communication guidelines and ground rules. So anytime we have a community conversation, we go over these. The first is honesty, that we don't get together to debate who's right or who's wrong, but to be willing to share our honest experiences and ideas, beliefs, and opinions, and to be willing to listen to other people's experiences and thoughts. We also believe in equality. As I said, we have panelists selected for particular reasons, but all of us are equal and valuable contributors to the conversation. Respect, all of us have preconceived ideas, and they can get in the way of our really listening to each other. So we want to be aware of that so we can remain respectful to each other and to ourselves at all times. We want to practice active listening. That's something that isn't as reinforced in our society. Usually we're encouraged to be talking, and a lot of times we're thinking about what we want to say as opposed to what's being said, especially in a virtual format. So we really want to encourage everybody to try to practice active listening and give all of their attention to whoever is speaking. Responsibility. Every one of us has hot buttons, and they can be pressed unintentionally. If that happens, we want you to be able to name it without blaming anybody else for it. And finally, this is a shame-free zone. Shame never changes anything. It just pushes stuff further under the surface. What we really are trying to create is a safe environment for people to speak authentically and genuinely, and that we would receive what people say with a degree of grace, allowing for us all to experience a place of growth and reflection. If you don't agree with those guidelines or think you'll have difficulty complying with them, this would be a good time to leave the town hall. I hope everybody is staying and going to continue to be engaged in the conversation, but the ground rules are requirements. I'm going to start with a couple of polling questions. Whoops. To gauge how people are doing. As I said, we start from the premise of the Mental Illness Task Force. And so we're concerned about people's well-being. And so the first question is just, how is your own mental health right now? And this is not tied to you individually. We do have, by the way, 97 people logged on. So if you would just take a minute to click one of those buttons, and then I'll share the results. I'll give that a few seconds. And let me read those in case there's anybody that needs that assistance. Oh, we also have translators on the line. So if anybody needs a Spanish translation of this event, please make sure to let me know. You can put that in the chat box. The choices here are normal amount of stress, but I'll be fine. Some days are bad, but overall I'm getting by. I'm struggling and looking for resources. I'm in crisis and need resources. I'm okay, but there's somebody else that I'm worried about. I have about 88% have voted. Hang in just another second. I'm guessing that's all who are going to. So I'm just going to share those results quickly. Most people on the call are experiencing a normal amount of stress, but about a third are having some bad days, and we want to be aware of that. And a second poll. Oops. The next one is, what area are you most concerned about? And this is multiple choice. You can choose as many of these as you want, but what are the things that you're most concerned and worried about right now? COVID-19, the economy, racism, protests, police behavior, health inequities, isolation, and mental health care. And again, you can pick multiples. Wait just a few more seconds. It's about 85% have voted. All right, I'm going to end that poll and share with you the results. So the majority of the people on this town hall tonight are concerned with racism, and that certainly makes sense given our topic. 70% COVID-19 would be the next highest concern, followed by health inequities. So that's helpful. Thank you for participating in that poll. Now I want to turn things over to the panelists, but first, one of the questions that did come in had to do with the makeup of the panel. So I want to address that, and then we'll have the panelists speak. So normally our town halls are about some aspect of mental illness. We had to postpone and reschedule our town halls because of COVID, when we couldn't have our large gatherings. And we did that because our town halls are interactive. We didn't think we could have a community conversation without being able to meet in person. And then we discovered the Zoom breakouts. So we've had 2 virtual town hall meetings, one on mental illness and COVID, and one on ACEs and COVID. We were in the middle of planning our next town hall. It was going to be on COVID and the disproportionate number of people of color and communities of color who are being affected by COVID. So that was what we were in the process of planning when other issues of race came to the forefront, most notably instances of police brutality and the protests. And it was then that the HRC and Loudoun Library reached out, knowing that we had experience in leading town hall meetings, to see if we could help with a community conversation. So we decided, instead of having a second conversation, to launch this by expanding the scope of this initial town hall and turning it into a series. So this is our first in kind of redirecting, but the topic is public health, physical and mental, and how that intersects with racial justice and injustice, particularly in the areas of COVID, police, and protests. So the topic of racism itself is huge and multifaceted, and this is only the very first in a series of conversations that we hope will be engaged for the long haul. This is not a one and done by any stretch of the imagination. So we'll also be asking you, grassroots people who are our community, to share, just realize that there's no picture. There we go. To share your thoughts and suggestions for future conversations. Because again, we want to create that safe environment so that we can bring more and more people into this conversation. What we think is most important is that the conversation is starting. So to get it launched, we invited people from public health, policing, and mental health who could help provide context, but equally important, who could answer questions relating to public health, policing, and mental health. So our speakers are Julia Rupp. She's the executive director at Health West, where they recently declared racism a public health crisis. We have Derek Chia here, who's an epidemiologist with Ottawa County Public Health. We have Steve Kemper, who will speak to policing efforts in Ottawa County, and Jeff Hawk, who's planning to speak to policing efforts in the city of Grand Haven, as well as the mental health of public safety officers. And then Brett Van Tol from Pine Rest will talk about the effects of systemic racism and how that affects the mental health of all of us, whatever our race and ethnicity. So each panelist will have 10 minutes to speak, and when they're finished, we'll move into Q&A. As I mentioned, questions that were submitted ahead of time were given to our panelists, so we expect that those should be answered as they speak. If you have a question, as people are talking, please put it in the chat box. And with that, I want to turn things over to Julia Rupp.
Okay, first we start with unmuting. Good evening, everybody. And thank you so much for inviting me. This is the first one I've been able to participate in. Health West is located in Muskegon County. And Barbara tells me she wants to make this regional. I had one of our staff, actually our individual who said, why can't we do the same thing in Muskegon County? And I said, well, let's see if we can just join forces with Barbara and make this bigger and better and truly regional. So I have been the executive director of Health West in Muskegon County for about 8 years. And Health West is Muskegon's community mental health services program in Ottawa County. It's Ottawa County Community Mental Health. Like Ottawa County, we are part of county government. So we are a county department. I think that's somewhat important as being part of a governmental institution. Our mission is to be a leader in integrated healthcare. And so while we are, like other CMHs across the state, primarily focusing on individuals with serious emotional illness, serious mental illness, kids with serious emotional disabilities, substance use disabilities, and developmental disabilities, we, about 3 years ago, became what's known as a CCBHC, a Certified Clinical Behavioral Health Clinic, which is an integrated healthcare clinic. It means we also provide on-site healthcare, often to people that have not been able to get healthcare. Those would include our primary care I'm talking about. And those, for us, tend to be people that have substance use disorders, who have been kicked out of practices, people with developmental disabilities that their behaviors are such that other primary care docs don't want to serve them. So that's how we use our on-site clinic. In addition to that, though, we insist that as part of our treatment, because the brain and the body are one, that everyone's person-centered plan here integrates primary care, their physical health care, as well as their behavioral health care. And we're very proud of that fact and that work that we've done. We also have an on-site dental clinic, an on-site laboratory, on-site pharmacy, to sort of round out all of the behavioral health services that we've done. I want to say that we are very proud of the work that we've been doing along the lines of making this an organization that is respectful of all members of our community. We have all of our staff are required to get at least 8 hours of diversity training every year, and that's on top of whatever cultural competency treatment interventions they might be delivering. Everybody has to take mandatory implicit bias trainings. We have programs to try to help mentor and develop more people of color into positions of leadership. We do community gatherings to talk about, to have discussions addressing behavioral health issues for diverse groups. We have an ongoing team for inclusion, diversity, and equality that does all kinds of great things and trainings, and bilingual services, etc. Lots of CMHs do this, lots of organizations do this. And so, of course, while we want to note the good things we have done, I think like lots of other institutions, lots of other leaders, we're also feeling somewhat embarrassed and that we just haven't done enough. And I guess that's a little bit about what I want to talk about tonight, is some of the action steps that we have taken. In Muskegon County, 46% of those that are COVID positive are Black. And in Muskegon County, 14% of our population is Black. About 4.5% is Hispanic and Latina. and about 8.5% are COVID positive, Hispanic and Latina. So we know that that race is a factor here, and we're way overrepresented in the COVID pop. That's just a really hitting home kind of an example. By the way, we also are overrepresented in Muskegon County with the people that we serve. So people that live in adult foster care and with developmental disabilities and mental illness are also overrepresented in our COVID positive counts. So just something to note. When I take a look at, and by the way, I will share with Barbara some of our documents that I'm kind of referencing. Barbara mentioned that we did a resolution, our board did a resolution, we did a letter to the community, we have some additional action steps, and some documents that go along with that from our TIDE committee. I will share all of that with Barbara so that she can share it with you as some examples. And I'll also share with you or forward to her so that she can share all of my references, where I got my facts and figures basically. So I'm going to start by saying that one of the things that I realized very quickly is that we like to do things like use words like discrimination instead of racism. And I think that one of the very first things that I did to our staff was apologize for the institutional racism that's been going on in Muskegon County for a long time, and specifically in our institution or our organization. And we talked some about that. We still have a long ways to go. So this idea that racism, not race, causes these health disparities is what we really focused on. We know that Black people in the United States are sicker and die younger than white people. We know that there's well over 100 studies that I could find linking racism and social inequities to poor health outcomes. We know the National Institute of Health says that racial and ethnic minorities in the United States are more likely than whites to delay or completely fail to seek mental health treatment, and that somewhere between 75,000 to 100,000 people a year that of minorities have premature deaths, Blacks compared to whites. This gap isn't normal. This shouldn't exist. As humans, we are equal. We should get sick and we should die equally. And this isn't happening. And we have lots of things right in front of us like COVID to tell us that right now. The past and present racial patterning of the disease reflects institutionalized racism, which is present in not just one institution, but all of them. And I think to me that's a very important part. We spend a lot of time talking about other institutions, and the first place for me, I believe, is to look at my own institution. There seems to be two main places that people go. I think the good news is to explain these disparities. And the good news is that, you know, we pretty much abandoned this notion through science that that there's a genetic hypothesis that somehow inherently Blacks, for example, are inferior to whites, right? Their genetic makeup is what causes this to happen. So I'm not going to spend a lot of time talking about that because I'm hoping we've moved beyond that. Science doesn't support it. With that said, just a couple of days ago, I found myself in a conversation with someone who I considered a friend that wanted to explain to me that while they weren't racist, that they really did think that the problem was on, quote unquote, them, meaning they could modify their own actions. They could do something about their own behaviors, right? Yeah, they've had a tough life. Yeah, some of these people have grown up in it, but it's still their decision. They can still make better choices. They can choose to get more exercise. They can choose to eat healthier. This is a racist idea. This idea has been persisting with well-meaning folks and continues to persist in our community. We know that it's the discriminatory practices of institutions that cause these things to happen. It's not that someone doesn't know how to eat healthy, it's that healthy foods aren't available in their community. We know that there is marketing that targets specifically African Americans, that doesn't help individuals. It doesn't help individuals. Sorry, I got distracted by the chat. Barbara's telling me I have 1 more minute. So let me wrap it up by saying that we have to change the conversation to what's wrong with Black people, and instead ask what's wrong with our policies and our institutions. And, you know, if I had a lot more time to talk, and I think many of you have heard it, is that you have, we have lots of examples of policies and procedures in our country, in our state level, and our local level, and in my own organization, which I'm happy to share with you offline, of how we have made this a problem. Communities are vulnerable because of bad policies and disinvestment, not because of the people who live in them. I think my time is up.
Thank you, Julia. Thank you very much. And there is a question, and we'll ask all the questions after all the panelists speak. But I do want to encourage people to be putting questions in that chat box, and we'll address them after the panelists speak. So at this point, Julia, I'll ask you to mute yourself. Here, I'll just mute you. And we'll hear from Derek. Derek Chia from Ottawa County Department of Public Health. You want to unmute yourself?
Yeah, thank you, Barbara. Do you have my slides up?
Oh, yes.
All right.
Thank you for reminding me. There we go.
While Barbara is pulling up those slides, once again, I'm Derek Chia, and I'm a public health epidemiologist with Ottawa County Department of Public Health, where our mission is healthy people, and our vision is healthy people, and our mission is working together to assure conditions that promote and protect health for everyone. So we are a government entity too, and we're here to serve our residents. So today I'm going to be talking about the disproportionate effects of COVID-19 on communities of color as a whole. Next slide, please. So most of the data in this presentation today is preliminary, and it's subject to change. So as the pandemic continues to unfold. Next slide, please, Barbara. Yep. So I'd like us to take a look at the data first, and this is national data. And so what I really want us to look at here is look at all those bars and see, we're trying to see which bars stick out most from the dark blue bars. So the dark blue bars show the proportion of these demographics in the population. The red bars show the proportion of cases they make in the United States, and the gray bars show the proportion of deaths they make in the United States. So basically what we're seeing here is for Hispanic folks, for example, make up 18% of the US population, make up to 34% of the cases and 17% of the deaths. So we're looking at about 1 in 3 cases of COVID-19 in the United States are Hispanic, and about 1 in 5 deaths are Hispanic. So we see here the infection rates are about 2.3 times higher among Hispanic folks than among white folks, among non-Hispanic folks, and death rates are similar across both white and across both Hispanic and non-Hispanic folks. Our next slide, please. So looking at race, I've been speeding to come up to this one. So looking at race here, some of the biggest disparities we see here are among Black and African Americans. So Black folks make up about 14% of the United States population, 21% of the cases, and 23% of the deaths. So infection rates are about over 3 times higher among Black folks than it is among white. And death rates from COVID-19 are about 2.6 times higher among Black folks than among white. So that's the biggest disparity by race nationally. So next slide, please. So looking at COVID-19 severity, just another way to quantify how severe COVID-19 is affecting communities of colors. We see that most minority populations are hospitalized at a way higher rate. So American Indians are have a 5 times higher hospitalization rate than white folks. Hispanic and Black folks have about 4 times higher hospitalization rate from COVID-19 than white folks. And the hospitalization rates are about 1.2, just slightly higher in Asians than it is among white folks. So white folks have the lowest hospitalization rates for COVID-19. Next slide, please. And so here in Ottawa County, let's look at our local data. And so on the next slide, we see that the disparities we see by ethnicity is pretty similar to what we see at a national level, where Hispanic folks make up about 10% of the Ottawa County population, but make up to 42 or 43% of our cases and 8% of our deaths. So to quantify this, we can say 1 in 2 of our cases, roughly 1 in 2 are Hispanic, and 1 in 12 of our deaths are Hispanic folks. So infection rates are about 6.8 times higher in Ottawa County among Hispanic folks than among non-Hispanic. And for death rates here, deaths are relatively lower among Hispanic folks. And so we really cannot make a reliable comparison in death rates for this slide. Next slide, please. So looking at the disparities by race, we see a pretty relatively fair breakdown of cases in relation to their population composition by race, except here where whites make up about 88.4% of the population in Ottawa County and make up to 96% of the deaths. Again, all this here relatively comparable, and we're keeping an eye out for this right here. So next slide, please. So then the question comes, why, right? So I think Julia made a good point to say, hey, our race doesn't put us at a higher risk. We don't have any, there's no genetics that inherently put you at a higher risk for COVID-19. But then we know that the social determinants of health play a big role in determining health outcomes. And so that's where someone works, where you play, where you live. All these things really play a role in your health outcomes. So generally, more exposure, more underlying health problems, and less access to care has been reported among minority populations. So let's look at work circumstances, for example. So critical infrastructure workers, for example, now we're looking within COVID times where we designate what's considered essential services versus non-essential services. And what we see that nationally, nearly a quarter of employed Hispanic folks and Black folks are actually employed in the service industry compared to just 16% of whites. So we're looking at when we're designing, designating some of these industries as essential services, it's actually increasing the risk of exposures among these minority folks. And so some of these jobs actually come with inadequate paid sick leave. So folks are sick and they're still going to work because they get to, that's the only way of livelihood. And so if say they're infected, they then pass on that infection to other people. Looking at living conditions, for example, so population density, we do know that members of racial and ethnic minorities may be more likely to live in densely populated area because of institutional racism in the form of residential or housing segregation. So looking at the role racism plays in here, we can look back to Jim Crow laws. So back in the late 19th century and early 20th century, where these rules were actually designed and enacted to disenfranchise Black people, creating so much barriers in housing, in healthcare, in segregation in schools and all whatnot. And so, I mean, these were in place until like 1965, so just about 50 years ago. And so looking back, we still have a ripple effect from most of those systems that were designed to disfavor a certain group of people. So we are actually seeing the effects of that today in our healthcare system as well. So looking at proximity to healthy food. So Julia made a good point about how accessible is healthy food to people. Like, are they eating healthy? Are they working out? Are we preventing chronic conditions? And we've seen that COVID-19 has actually been much more fatal among folks who have underlying health conditions, and access to healthy food is a huge determinant of chronic conditions. And just access to medical facilities as well. How close can I get to a medical facility without facing the barrier of transport? So looking at multi-generational household, again, because of those laws that were put in place to prevent minority population from buying houses in certain areas, we then had that issue where we have a lot of multi-generational homes, and it's easier for COVID to spread in such a setting where you're staying at home, maybe with your three generations of people. And so we do know that minority folks are more likely to live in multi-generational homes. And so we talk about mass incarceration, and that's a big part here. COVID-19 has actually shown to spread really effectively, especially in congregate settings. And looking at our congregate settings, so our jails, prisons, and detention, they're often disproportionately full of minority folks. So looking at underlying health conditions, so the lack of insurance, just overall access to care has been a huge one. So language barrier, transportation. So do I understand prevention messaging in the way that I can be able to prevent myself and my family from COVID-19? Can I transport myself to seek care? Those are some barriers to that we think might be playing a role here. Just distrust of the healthcare system as a whole. Looking again historically, like I can think off the top of my head, the Tuskegee experiment, where there was an unethical experiment that went on, and folks were injected with a syphilis virus. And so, just looking back historically and reflecting on those things, there's groups of people who have a high level of distrust in the public health or the healthcare system, and those are some things we need to pay attention to in public health. So language barrier, I mentioned that already, and just serious underlying medical conditions, stigma, and systemic racism. So I would just like to look at some local data here in Ottawa County as well, just to see how we're doing for some of the things. Just stay on the previous slide, please. So for example, here in Ottawa County, from the behavioral risk factor survey, we know that among Blacks who took that survey, only 24 of them owned the home they lived in, compared to 53% Hispanic and 61% Asians and 86% whites who own their own home. So we really see a huge disparity there by race. And so these are some of those things we see in our own backyard, and we're wondering how those play a role in some of those things we're seeing around COVID. And just looking at access to care, for example, in Ottawa County, among those who took the behavioral risk factor survey, among Black folks, 17% went without health insurance just within the previous year, compared to 16% Hispanic folks and just 3% white. So we're really trying to bring down those barriers in other minority populations and make sure we all have a level, even playing field. So next slide, please. So the question now comes up, what are we doing about some of these things? So go back one, please. The 2 slides up. All right, while that's coming up, by the way, we can look at what we're doing about COVID-19 disparities because of some of those reasons.
That's the next one.
Yep,
I don't have is that one right?
Yeah, this one's right, yep.
All right, thank you.
Yep. So because of some of these disparities we're seeing in COVID-19, here at the health department, we've been working really hard to address that disparity we're seeing among our Hispanic population. So we put in our culturally competent staff across different teams who work in really target messaging and prevention messaging, especially among our Hispanic population. They handle case investigation, contact tracing, and just provide education, resources, and link folks who are having higher rates of infections to care and low-cost services that they need. So we've been partnering with our community leaders, nonprofit organizations, church leaders, local media, just to improve our messaging around prevention, testing, and the resources to prevent COVID-19. And so we've distributed over 1,200 outreach packages that contain masks, hand sanitizers, and just additional material just across the board in the county. We've been targeting our ethnic grocery stores, places of worship, food pantries, and just places where people have turned to more during the tough times we've been in the last few months. And so we've had frequent communication in both English and French to break again that language barrier that might be existing out there. And so we've worked with radio stations, we've done videos with community partners as well, social media, printed material, and just interpretation and translation resources as a whole. So we've been working really hard to combat misinformation and rumors around COVID-19. And again, it's something we're learning more about on a daily basis. And we're making sure we just break down any rumors that may suggest otherwise. And so we did have a community testing event a few weeks ago, and we strategically located that in one of our zip codes that had a higher proportion of Hispanic folks and higher proportion of Hispanic cases, just to make sure we're catching potential contacts to people who might need testing. And we're working with other community partners to promote messaging and testing efforts. So next slide, please. We know that besides COVID-19, health disparities have always been a thing, so looking across the board, different communicable diseases, we've seen disparities. So for example, I can think of our STD rates, for example, chlamydia rates in Ottawa County were in 2018 were about 8.5 times higher among Black folks and about 3.3 times higher among Hispanic folks. So looking at really even chronic conditions, there are some disparities that are reported there. And again, most of this tie back to those the systemic racism and inequities we've been seeing. So as an organization, we've been working hard, and just point out here, one of our key core values is equity, integrity, and excellence. And we really emphasize on equity because we believe healthcare everyone should be able to live the healthiest life possible. So we have a standing health equity committee where we assess our policies periodically or frequently to see what policies can be improved as an organization, what do we need to work on to attain health equity. So we've been working on our trainings on implicit bias and just assessing our recruitment strategies and hiring processes. And we've been gathering more data to understand the full picture of some of these. Again, Barbara just nudged me, my time is up. So thanks for this opportunity to talk to you all today, and I'm looking forward to some questions.
Wonderful. Thank you so much, Derek. Very helpful. I want to ask now Steve Kemker, if you could unmute yourself and talk to us about the Ottawa County Sheriff's Office.
Yes, good evening, Barbara, and good evening to everybody that's joined in here tonight. I got to throw a plug in here for Derek. I've been sitting through all these COVID briefings over the last couple months, and Derek and the team at Public Health have just, we've gotten our work out of them, our money's worth, to put it that way. Derek,
thank you, Steve.
You amaze me every time with your briefings, and it's brought a sense of calm and sometimes a little sense of worry to all of us in law enforcement. But again, this county is so lucky to have a health department that we have. That's getting us through this crisis, and somebody of Derek's caliber to be on board with his knowledge and the presentations he gives. So again, just a little thank you to our health department and Derek.
Thank you, Steve. It's all teamwork. Thank you.
You bet. Thanks, Derek. Most of you probably know who I am. I'm Steve Kemker. I'm the Sheriff of Ottawa County. Just a little bit of background on myself. I've been with the county for 30 years and the Sheriff for the last 3.5 years. And total time in law enforcement about 38 years. So I'll be touching on two of the topics here tonight. First, just very briefly on COVID. Something that really took the law enforcement world and really put a whole spin on how we had to conduct business, not only dealing with people out on the street and taking and responding to calls for service, but I also have a facility called the jail. And our fear always is that, if COVID gets into a jail, and I'm sure you all saw the news where that did happen. So again, we had to change our whole way of policing, the way we dealt with issues, how we handled people, with speaking with them, and still providing good quality law enforcement services, because our number one priority are the victims of crime here in Ottawa County. And to provide that service to our victims and also for our general public that called in for other types of service needs from the Sheriff's Office. I'm pleased to say that we've been able to respond to all of our calls. We've been able to deal with the crime that was afoot. and have done it very successfully and healthy. Our entire Sheriff's Office staff, to this date, we have had no COVID within the ranks of the Sheriff's Office, which to me still amazed me, because many of my cohort around the state, the other sheriffs, were dealing with staff that was coming down with COVID. We lost several officers in the state of Michigan due to death from COVID. So our staff stayed healthy. We took a lot of measures, splitting our department up, putting us on different shifts so we didn't cross-contaminate each other, and that was successful. So on the jail side, our jail population dropped to the lowest that I have ever seen it. We dropped down to about 130 inmates at one point. During this time, you're probably aware the governor did authorize early release, and I did meet with the judges, and I did prepare a list and worked with the judges very closely as to who could be released from jail. And we did release probably right around 30 people from the Ottawa County Jail. I'm also pleased to say that none of those people returned to the jail. That was always a fear. Some of the public said, hey, who are you releasing? Who's coming back into the community? But again, we did mostly all nonviolent. Some people that were in there for, driving a license suspended, or maybe writing a bad check, or behind on some of their friend of the court payments. So again, I got to give kudos to the judges here in Ottawa County. They responded very quickly, and we were able to lower that jail population. We did have 2 cases of COVID that did show up in jail testing. We caught that very early on, and were able to isolate those inmates in another section of the jail. And to this day, they have been cleared, and we're sitting good with no COVID within the jail facility. The wear and tear on the deputies was a little, as you can imagine, they were curious. Some were worried because if they did come in contact with somebody with COVID, if they had to be quarantined, were they taking it home to their families, to their wives, their children, their relatives? So again, working with public health, with the education part for our officers was extremely important. And again, I think we've been very successful. And Derek probably hears this quite a bit. Is it coming back? We're starting to see some cases pop up. Some of the bars in Grand Rapids, I think we're 1 or 2 in Grand Haven area, have now closed their doors because employees tested. So again, we have the personal protective gear for our staff. And like I said, we did change the business a little bit. We asked people, we may meet you outside or ask some questions. Please don't be offended by that. And the public response has been overwhelmingly great in dealing with the COVID. They understand that they may get a phone call instead of personal visit. And again, so we've been very successful getting through the COVID crisis, and we hope that it disappears soon. So when it came to George Floyd, first, I don't know if many of you saw the statement that I put out along with 82 other sheriffs in the state of Michigan. It has changed law enforcement. When I saw what happened, I could not believe what I was seeing. Some people said, we've been down this road before, we've seen this before, and completely condone that activity. It was criminal. And again, with our staff, they know very clearly the stance that their sheriff takes, that the executive team takes, and also the leaders of Ottawa County. I think a lot of good is going to come out of this as far as some police reform. And I'm proud to say that when we look at the list of things that are out there, like no chokeholds, the duty to intervene, another officer to intervene if he sees something wrong, we have that all in place already. Our agency is based on the philosophy of community policing, and we started that almost 25 years ago, and we've stuck with that. Involving the community, being out there working with our community. We do a lot of contracting with our townships, 3 cities and a village here in Ottawa County, who've entrusted us to come in and do the policing in their community. And we sell that as a community policing program, that we will be there, we will be involved with the communities, we'll work to come to good solutions to problems and issues. And we've done unusual things. Some of you may have seen the two deputies from our agency that were involved in the artwork type project up there in Spring Lake. We're involved with our schools very heavily. And we have deputies that their regular job is to be at the school, but they're there mentoring, they're there teaching, they're there coaching. Their children are in the schools that some of them police in, and they really take pride and ownership at the school levels with our school resource program. And it's the same for all of our deputies. We all live in this community. We've got an excellent staff on hand at the Sheriff's Office. We're one of the larger Sheriff's Office now in the state of Michigan. And again, our backbone is community policing. So when it comes down to that, if you ever have the opportunity, I would encourage you to go onto our website and take a look as to who the Ottawa County Sheriff's Office is and the things that we do in our community and working with our people in the community. But take a look at really our mission statement that's there. We're built on these core values, and I put this into place when I came into office. And these were also in place prior. I do have to give kudos to Sheriff Gary Rosema, who's retired now. He was kind of the father of bringing the community policing into Ottawa County, holding high standards for our deputies. Ethics and integrity are huge in our department, and treating everybody equally and training. So I continued with that, and we're building on that yet today. So some of our core values we list as professionalism, respect, integrity, dedication, excellence, equality, and diversity. And if you look those up, there's some explanations behind those. We also have our vision with the Ottawa County Sheriff's Office is that we have safe and secure communities where the rights, the history, and culture of each citizen is valued. And we'll achieve this by collaborating with our communities and our citizens within our communities to identify problems and work on those problems before those problems either become larger or become an ongoing issue. And we'll be an organization in which each employee embraces integrity as the cornerstone upon which the public's trust is built. We will foster an environment of an honesty, of trust, and mutual respect in which the Sheriff's Office and community work together. And then I go into our mission is to provide professional and ethical law enforcement and correctional services. And it's based a lot on customer service. And again, to support the Constitution and really to make Ottawa County a great place to live and work in, to preserve public order, reduce fear, and provide safe and secure communities for our citizens. So how do we get there with our staff? The first thing is hiring good people. A lot of our staff comes from within Ottawa County. They've either gone to school here, they have grown up here. Myself, I'm a lifelong resident of the county. I grew up in Holland, Michigan, now live in the Zeeland area. And we're all embedded in our communities and take great pride of our community. So with that community policing, it's getting out, interacting, working with the public, working with all of our groups here in Ottawa County. But with that comes the training. And again, I think that we are ahead of other agencies outside of Ottawa County, because I'm going to tell you right now, and I know Chief Hawk is online with us here tonight, we have great law enforcement agencies here in Ottawa County and even surrounding us. Myself and the chiefs here in Ottawa County, we all work very well together, whether it's being and working on committees in our communities or our staff working together to prevent and solve crimes, and again, to work at community type events. But training is very important. And we started this years ago. And I am so glad that, Sheriff Rosema started the hard training that we've continued it today. We've been through fair and impartial policing, ethics and integrity training, de-escalation training. We use verbal judo training, diversity training, and also the one that was really the most popular training in the Sheriff's Office was the Disney Way customer service training. At first, When you tell a group of people we're going through Disney customer service training, they probably all thought we're going to sit around with Mickey Mouse ears on. But this proved to be some of the best training that the Sheriff's Office staff rated is customer service. And trust me, I can show you documents and files. It has paid off from what we hear back from community members when they deal with our deputies. We know that we're going to be doing a lot more training. We train. And we know we're going to be doing more, which I am perfectly fine with. The governor released 4 things today that she wants to see in policing. And right now, I got to agree with all of them. There's policy, personnel, partnership and community engagement, and prevention and accountability. We do use of force reporting, both internally and externally. All 83 sheriffs in the state of Michigan, I believe we are one of the first states in the nation, all of us do the data reporting to the FBI on use of force. Our deputies are trained in reporting. And again, we keep all those and they're all reviewed. But with some of the policy changes that the governor wants to make, and again, we have all these in place already, is banning chokeholds, limit the use of no-knock warrants. We pretty much take the stance that we knock and announce and make as much effort as we can on warrants. And the duty to intervene. If an officer sees something's wrong that another officer is doing, that person does have to take that and intervene and say, hey, this isn't right. And we've seen that in West Michigan. One of the things the governor listed down here, and I'm really intrigued by it, and I want to see where this is going to go, is classifying false or racially motivated 911 calls as a hate crime. Again, I go back to an incident years ago in Grand Haven Township where a black male was out delivering phone books through a neighborhood. And the phone board at Central Dispatch received numerous calls because a black male was walking through the neighborhood. None of those phone calls told us the fact that he was putting phone books at every mailbox. And that really drew a concern to us as the administration. And that was probably already about 6 years ago that had occurred. So it's going to be interesting. I'm curious to see what the legislation will be on that one. The governor is also going to put a lot of emphasis on training, and through MCOs, which is the Michigan Law Enforcement Officers Training Council, they license the people as police officers in the state of Michigan. They want to do accurate reporting of violations of police officers, which we already do. When it comes down to if a officer is let go from that agency, to make sure they don't get hired by another agency, to make sure that that is visible by other law enforcement agencies. And that tool is already in place. But again, I think that can be refined more. Years ago, we used to call them gypsy cops because they would move from agency to agency. And if these agencies didn't see or do proper background checks, they could potentially end up with an employee that may cause some issues. The other big one, and I'm really glad to see this because I do sit on the governor's Mental Health Diversion Council, and myself and the chief from Norton Shores, Chief Gale, we both sit on there. I represent the Michigan Sheriffs, and Chief Gale represents the Michigan Chiefs of Police, is working on mental health training for law enforcement, how to deal with people with mental health incidents, what to look for, resources. Again, we collaborate very closely with our county mental health and resources here in Ottawa County. I think that that's going to, and I've been pushing for several years now to really fine tune that and get more collaboration with CMH, with law enforcement, and get the proper training so law enforcement recognizes people that are having a mental health incident and how we deal with them and work with them. So again, I'm proud to say that we run a tight ship with the sheriff's office. If there are issues, the executive team or myself and the undersheriff, we do address them. And again, I feel very confident in our staff. We cover a large, diverse county, and we are out there 24/7 for you. And again, if there are issues, we do directly address them immediately.
Thank you, Steve.
You bet.
Thank you, Steve. Jeff Hawk is next, and I just want to remind my speakers, please try, to set your own timer for 10 minutes. I'm putting a note in the chat box if you go over, but you might not see that. So just want to be cognizant of the limited time we have tonight. So Jeff, if you would unmute yourself, and I'll work on getting your slide ready too.
Well, hello, everyone. Thank you, Barbara, for inviting me. I'm Jeff Hawk. I'm the Director of Public Safety, Police Fire Chief here for the City of Grand Haven. First, I want to thank everyone in the community for the support that we've received in the last couple of weeks. We really appreciate it. I want to thank Luann and our Human Resources Commission here in the city for working closely with us. They actually put up a statement on the city's webpage, and part of that statement is that they're committed to working with the Department of Public Safety to address any and all issues. And we don't see that in every community, and we really appreciate it. Tonight, I hope to bring you a little bit of good news. I want to start first by examining the killing of George Floyd, which was a horribly brutal incident in Minneapolis, just from a different perspective, maybe from a perspective of a law enforcement leader as a chief, how we prevent that from happening, what we have to do to make sure those things don't happen in our community or any community. And I put together some local statistics on use of force, which I think you might find interesting. Some very specific data. I'll run down through that quickly. And then I want to quickly wrap up by touching on some of the topics that Barbara sent previously, some of the questions that were answered. And I'll run down through some of those topics and answer those from Grand Haven Public Safety perspective. So starting with the George Floyd killing in Minneapolis, a horrific intentional act by that officer. When we look at these things as a chief, as a law enforcement leader, we're going to find that we in our department have a failure in one of 5 areas. And I think Sheriff Kemper expertly touched on a couple of them. We call them the 5 pillars. This information has been around for a long time. It's law enforcement best practice. It's by one of the premier trainers in the country. I first started getting training on this almost 20 years ago when I first got promoted to chief in Cadillac, where I was chief for 9 years, did 25 years total in the police and fire department. Been here in Grand Haven for 8.5 now, 8.5 wonderful years. You see a lot of the information, changes currently being discussed, laws that are being authored, and a lot of this has been around for a long time, and it's all part of the 5 pillars of successful or expert law enforcement. And the 5 areas that we need to focus on, the things that need to happen to make sure as law enforcement leaders that these things don't happen in our departments. And I don't know if the officer in Minneapolis was racially motivated or not. I don't know what was in his heart at the time, and I don't know that much about him. But it's really a safe statement to say that he was an extremely brutal individual to do what he did. So definitely horrible, brutal individual. So I'm going to approach it from how do we stop a brutal person like that? And if he had racial bias or he acted out of racism, how do we stop that also from happening in law enforcement? How do we stop them from practicing as the police officer? And, the 5 pillars, the areas that we need to really look at continuously and reevaluate: people policy, training, supervision, and discipline. And Sheriff Kemker touched briefly on the people and the training. So going back to the people, we have to hire the best people. We can never let those people in the door in the first place. We can't let racist individuals or brutal people in the profession. So we have to have thorough and methodical hiring practices that identify best candidates. We have a really good system in place in Michigan right now, the Michigan Commission on Law Enforcement Standards, some of the highest standards in the country. And we have to do things like initial testing procedures, oral interview panels. And one of the most critical keys is the extensive background investigations. That's where we find out about what makes these people tick. The background investigation, and I'm not talking about just running some computerized checks, I'm talking about actually talking to family members for these candidates, talking to neighbors in the neighborhood where they used to live, talking to teachers. I'm talking about really delving into their background to determine what they're all about. And then also an extensive psychological evaluation before they're hired. And that often will identify problems that we might have with an individual, and we might get a recommendation not to hire them. So we have to get the best people. We have to get kind, compassionate, competent people, and then train them in the law enforcement profession. When we start with a good human, we're going to end up with a good officer. And then policy, we need straightforward policies based on the law of the land. We have to make sure they're legally and morally up to the standards that we're looking for, up to the legal standards. And the policy has to be communicated to officers and reviewed frequently. We just can't author it and then let it sit out there. We have to have the officers constantly in the policies and reviewing them frequently, especially in the high-risk areas, so that every officer is well versed and the expectations are clear on what our expectations of them are. And then Sheriff Kempker talked about the training. We have to train frequently in all areas, but even more frequently in all high-risk areas. So that is a huge piece of it. Here in Grand Haven, we train monthly. We focus on high-risk areas. One of the areas is use of force. We've completed the fair and equitable policing training. We just recently completed a extensive training from Western Michigan University on responding to people that are suffering from mental illness. So training is very important. And another important part of it is supervision. It's possible that officers can change over a career, and we have to have appropriate levels of supervision at all times for the people that are working in the community. Here we always have a sergeant or a senior officer in charge and responsible for the officers that are working. When we do see problems with an officer, they're identified and corrected immediately. Another supervision tool is what's called an early warning system. There are a couple of different important components. Just for example, what an early warning system might look like for a police department is we look at a variety of different data and categories for a specific officer. So if an officer has a higher than usual amount of citizen complaints, disciplinary actions, use of sick time, excessive use of sick time can also be an indicator that there's something going on with that officer. There may be something legitimate, or it may be something to do with substance abuse or a substance problem that we need to check into further. And then another example of a component of an early warning system would be an officer with an inordinate amount of resisting and obstructing arrests. In other words, their contacts with the public result in an inordinate amount of resisting and obstructing arrests. So those would all be components of an early warning system. And then the final pillar is discipline. When something does happen, when an officer does an intentional act or makes a serious mistake, the appropriate discipline has to be applied, and it has to be timely, and it has to be meaningful. And I'm a big proponent of positive discipline as well. I'm a firm believer that you get more of what you pay attention to. So an example from the command staff and from command officers is very important. And officers need both positive praise and negative discipline, just like any other human or any other person doing a job. So those are the 5 pillars. Those are the things that as a chief, I look at consistently in the organization, and using those pillars, using those areas of extra attention, that's how we keep these things from happening. in our community, and that's how chiefs in other communities keep these things from happening. I also wanted to, we got some questions about local statistics for use of force. I've had a couple questions even recently. So I put together some statistics for 2019 and year-to-date 2020 that I want to share with you, just to give you a clear picture of what actually happens here locally. And I also did a racial breakdown on the statistics. So when we're talking about use of force, we're talking about overcoming physical resistance during an arrest. And how do we record a use of force? What we do is anytime an officer uses force, there's a detailed report that's completed in addition to the standard police report. A use of force reporting form is completed, and that's reviewed first by the sergeant, then the lieutenant. And I just hit my 10 minutes, so I got about 30 seconds left, Barbara. Reviewed by the sergeant, lieutenant, captain, and chief. And I think this is important, so I'm going to go ahead and go through it for 2019 and 20. In 2019, in our department, we had 24 use of force incidents. The racial breakdown was 13 white male, 7 white female, 2 black males, and 2 black females. 9 were compliance controls. That's a soft, empty hand technique like an arm hold. 3 physical controls, which would be a strike or a takedown. 7 intermediate controls, which would be pointing or using a taser. One of those was a taser deployment. We had 5 times a weapon was aimed at an individual, a suspect. One of those was a felony warrant, resisting, obstructing. 3 fleeing and eluding. 1 armed suicidal person, which is an attempted or a probable suicide by a cop. So anytime that a weapon's aimed, it would be at somebody that's probably or definitely armed. We had 4 officer injuries in 2019, 1 laceration, 2 abrasions, 1 with human bites. And we had 4 suspect injuries, 2 abrasions, 1 complaint of muscle pain, and then 1 from the taser probes. Very much on track for about the same year for 2020. And so that's kind of just a brief summary for the last year and a half. If we look at all arrests, Grand Haven Department of Public Safety officers use force very infrequently, and historically about 3% of the arrests we use force. So I hope that gives you some picture of what's going on here locally. As far as chokeholds, they're not allowed. I've never been trained on a chokehold. It's not part of our training curriculum. It's considered deadly force through our policy. De-escalation training has occurred. The goal is always voluntary compliance. It's been a staple of law enforcement training since the 80s. And these are some of the things that people have been asking about or that Barbara sent as far as our questions. And, you know, going back to the late 80s with the verbal judo training is when de-escalation training really took off in the police service. And then there was a question about defunding the police. I just want to touch on that briefly. Any community can have whatever police department or police force that the community wants. The departments are funded mostly by tax dollars, and tax dollars are allocated by the elected officials, the people in the community elect, the folks that are elected by the people in the community. But I think nationally, the conversation started at the wrong end. And I think what the conversation really needs to look like is, you know, what a community considers funding level. When a community considers funding levels for a police department, or if the community even wants a police department, the first discussion should be to decide what laws and ordinances the community wants enforced and by who, and what laws should go by the wayside or be repealed, and then actually determine the funding for the police department. So I think that's where the conversation needs to start. I just want to close by maybe Barbara can put up that slide of just a few things that have happened here locally.
Yeah, but really be succinct.
Really succinct. Just a couple of things, and you can get this off the materials. Just want to say I'm really proud of our officers that work here. Very proud of their service in our community, very proud of what they do each and every day. So thank you all, and thank you, Barbara.
Absolutely. Thank you, Jeff. Appreciate it. And again, other questions we will direct to Jeff during our Q&A time. So at this point, I'll let you mute and ask Brett Van Tol to unmute yourself and plan on 10 minutes. So Brett, are you on? I think you're still muted. Oh, no, that's not Brett.
I'm guessing that it's his headphones that are bad.
Okay,
He's showing unmuted, but we can't hear
How
him.
about there? Can you hear me
There you-
now?
yes,
Now we
Yeah.
can.
All right, very good, good. Yeah, so I thought about what to do with this time, and part of what I thought about is, we certainly could run through a number of facts or statistics about racism and impact on mental health. But in struggling with this a little bit, part of what I couldn't get away from is, at least in the most northwest corner of Ottawa County, I'm speaking to a population that is largely white, probably north of 95% white, the last I knew several years ago. So I really want to kind of take this time and really bring it back home. And I want to almost, in a way, talk about racism and the effect of racism as I would, if you were in an office with me and we were doing some therapy together. And Barbara, I appreciate sort of bringing the context of this into sort of West Michigan. I think it's important to note that, we have areas that are more diverse when we get away from the Tri-Cities. And I think that's, that's an important thing to recognize, and maybe some questions that we could ask in terms of that. But one of the things I think we need to deal with is pain. And, we talked a bit, both Steve and Jeff alluded to the George Floyd incident. And I think for all of us, that brought home a sense of some kind of pain. And I think we need to ask ourselves, where on this scale do we stand? And in terms of therapy, the first step would be, looking at kind of the stages of change. Am I in a place where I'm denying this, where I'm, maybe afraid, where there's some anger, where I take sort of the stance in terms of racism of, I don't hear it, I don't see it, right? I don't feel it. And there's a kind of a denial. There isn't a movement towards change. Or if we go a little farther up that scale, I think maybe where a lot of us may be is kind of a passive tolerance. Yes, racism is there. I believe it, right? But there isn't a willingness to kind of own the racism within my space. And when I say my space, I mean the space that you influence, right? The space that's within your arm's reach, the people around you. Are you at a place, are you at an action place where you're willing to say, hey, there's something I need to look at in my sphere of influence, where I need to start to look at what does the pain of the George Floyd incident mean for me and the people that I interact with? I think the interesting thing about pain is, what do we do with understanding pain? One of the things I do in therapy is, when somebody is saying something to you, and much like happened when I started talking, you couldn't hear me. So we said, hey, there's a problem, I can't hear you. I plugged my microphone in a little bit more, and now you can hear me, right? So if I'm saying something and you can't hear me, I can talk louder, I can fix that. But if I'm feeling something and you can't feel what I'm feeling, how do I make my feeling bigger? And that's where we often see acting out, right? Because we act out to make our feelings bigger. And the problem for so many of us in terms of listening and understanding is we focus on the action and not on the meaning underneath the action. One of the things I'd like to think about as I was listening to Julia and Derek and Steve and Jeff talk tonight, is one of the things that struck me, and I'll throw Barbara in on this too, is that all of these people are in the business of making things right. And in order to do that, we've got to be able to listen. We've got to be able to hear. I think particularly for Jeff and Steve, I heard both of them talk about, law enforcement, and I think we can hear that the wrong way too quickly. I think we need to be able to hear that as the business of making things right. I'll talk a little bit more about our story as a community, but as a community, we've got to be in the business of making things right in our community. And in your life, in your sphere of influence, you've got to be in the business of making things right. One of the questions early on was about, do corporations have a business statement, a mission statement? And are some of the issues of racism included in their mission statement? We can bring that down to our own lives, right? Do we have our own mission statement for our life? And what does our life say about sort of racism? And so where I want to get with this a little bit, right, is how I deal with racism as a white male, how we deal with racism as a largely white community has to do with our own mental health too, right? This isn't about the mental health of people of color. This is about the mental health of each one of us and looking at how it affects us. The step 2 in terms of therapy is, what's the goal here? Everybody, Julia, Derek, Steve, and Jeff all talked about who we want to be as a people, who we want to be as a department, who we want to be as an agency, but it's who we want to be as a people. We've got to define who we want to be and who we want to become. That's a big part of therapy, because what that gets into is the whole issue of fear and the issue of fear on racism, right? When we look at acceptance of pain versus feeling safe in therapy, a lot of people want the pain cured. They want the pain to go away. But sometimes the pain can't go away, so we got to focus on the acceptance of the pain, and that leads to discussions about vulnerability. Vulnerability makes us feel weak, and we want to be strong because we want to be safe. But the problem with that is we can create very quickly a false sense of safety, right? It takes a lot of strength to be vulnerable. And I think part of what we really need to look at, each of us in our own lives, is our willingness to be vulnerable, to learn, to be caring, right? And to have the strength to do that. One of the important things in doing that is looking at, how do I come to understand my world? And one of the things we know as psychologists is we understand a world based a lot on assumptions. Assumptions help us quickly process information. But one of my very favorite speeches is a speech that Alan Alda gave to his daughter's graduating class. If you have a chance to look that up sometime, it's a wonderful speech. But what he talks about is that assumptions are our window on the world. And just like windows get dirty, our assumptions get dirty. And we have to take the time to clean our assumptions off. We have to take the time to clean our bias off, because we've got to own that we all have assumptions and we all have bias. And we've got to clean those off. We've got to go through the work of doing that. So, I think in terms of fear and in terms of vulnerability, right, that's the work of cleaning off your assumptions. And the next thing is to learn that assumptions, a lot of them are taught. And that gets back to, some of the terms that Julia used were things like cultural competence and implicit bias. There are also terms like microaggression and systematic racism. These are all taught or passed down kind of assumptions or actions, behaviors based on assumptions that we've learned, that we need to clean our windows off. We need to be able to take a look at them, and we've got to ask challenging questions about them, which means we've got to allow ourselves to be in a space of vulnerability. So I think all of that brings us down to, what is your story? What is your story with respect to George Floyd? What is your story with respect to racism? And how are you going to look at this issue in your life? And that brings me to kind of a final challenge here. And it's a challenge of looking at the issue of equality and inequality. One of the things that we do in psychology a lot is we do something called cognitive reframing. And that means looking at a situation from a different point of view. And we can all wish for equality and want equality and desire equality, but we have to acknowledge that inequality exists. And one of the things that happens with inequality is inequality gives you an opportunity. In the place of inequalities, you have an opportunity for love, you have an opportunity for generosity, you have an opportunity for caring, you have an opportunity for giving, you have an opportunity for understanding. And I think we need to learn to sort of embrace inequalities where they exist so that we can use that as an opportunity, right, to advance the qualities that we all want to sort of make our story of our life and the story of our community. So, you know, I'm a psychologist. I deal more individually, one-on-one, but I try to kind of see you all as, you know, how can we sort of address this issue in our lives? So thank you, Barbara.
Thank you, Brett. Appreciate that. We do have a number of questions, but we will not have time to have any community conversation if we go over all 13 questions. So what I am going to ask Jenna to do is just read the questions that have come in, and then we're going to give those to the panelists, the appropriate panelists, get those responses, and then send them to everybody. So hopefully that's okay. And with her reading, if you think of another question you'd like answered, just add it to the chat box, and we'll grab all of those, and we will give them to the panelists, and we will get those answers back to you. So Jenna, if you could just read the questions that have come in so everybody knows, and if they thought they asked a question and they don't hear it, they'll know to put it in the chat box now.
Yep, so for Julia, we have, do you have a strategic plan to address and remove institutional racism from your organization and make it more equitable? The second question is, how much help do you need financially and with personnel to expand services in other parts of the county? For Derek, how many of the Hispanics are migrant and how many are full-time residents? For Steve, we have, does our sheriff's department mirror the population? Do we have officers who speak Spanish, people of color, and women? Could the number of whites be so high due to age/reluctance to be safe or make changes? There's been trainings mentioned, but it only seemed from the titles that one was directly related to racism and white supremacy. What trainings do you have planned next on this topic, and when will they occur? Is implicit bias training part of the training process for police officers? If not, could you speak a little bit to why that is, and if you would think it would be possible or helpful to include that as part of the training process? Will the sheriff's office consider implementing both in-car and body cams? And what are thoughts about body cams? These questions were for Jeff. Do our law enforcement leaders support the transfer of some funding to implement mental health, social work, and other social and health personnel to handle those calls, which might be better served by other professionals, or at least in coordination with law enforcement? There was a recommendation for a training, which I don't know how to say the name. So we can include that in our notes. Can we put a screening in place for the officers we have now? The same new screenings you mentioned for new officers coming into the force? What measures have Grand Haven Public Safety taken to study and analyze for potential bias in their policing, like in traffic stops or other scenarios? How are you ensuring current officers are held to the same standard as the new people you are hiring? Are these statistics available anywhere since there is not a slide? Maybe we could develop a new community board who oversees the issues with our police officers. And the last question for Brett is a community built on neighbor smiling at neighbor, shared names. What is in common, making those connections?
Thank you, Jenna. And I do see some of those questions. I see Jeff has been answering in the chat box. I encourage anybody else to do that as we go. Otherwise, and we'll make that chat all available, but we'll also, again, any questions that aren't answered, we're going to give to those speakers. What we want to do now is move into the community conversation. So what I want you to do, you're pre-assigned. I'm going to send you to rooms. There's going to be 4 to 5 people in the room. If there's not 4 to 5 people, then I'll probably pop in and announce that I'll distribute you. But right now it looks like we have 4 to 5 in all of them. We also have a facilitator already designated so they can identify themselves and just make sure everybody gets a chance to answer the question. We're gonna, the first one is just introducing yourself and sharing why you're here. Why are you participating in this town hall? And when did you first become aware of the idea of race or have an experience of racism? And then the third question is going to be, what have you learned tonight? So those 3 questions, and then I'm gonna, the last 2 are the ones that we're gonna bring back to the whole group, and I'll send them, but they have to do with what can we do as individuals and what can we do as a community. I will send through the chat those questions to each room, so the facilitators will have that nudge. And when it's time to come back, you'll get a notice that it's time to come back and the break room will be closing. But we're gonna start with introduce yourself. When did you first become aware of race or racism? And what have you learned tonight? And I would spend most of the time on what have you learned tonight, because it's already after 8 o'clock. And we will take 10 minutes for those 3 questions. They're small groups, so that'll help. I'm gonna send you to your rooms now. Welcome back. I'm sorry we didn't have an opportunity to come together and break back up. Just a function of time. So what I want to do is we'll go through each of the break rooms, and if the facilitator could just share one thing that was learned, one thing we can do as individuals, and one thing we can do as a community. And then as we go through the rooms, if try to add something that hasn't already been said, but then any notes that you've taken, please forward to me. Do a screenshot or however to get them to me. We can type them up. That won't be a problem because we want to get all of this feedback, but we are woefully out of time. So I'm going to start with breakout room 1, Lynn Doyle. Oh, are you with us, Lynn? If you could unmute yourself.
Can you hear me, Barbara?
Yeah, now I can hear you.
Okay. I'll be brief. We had a really good conversation. I think some of the things we learned in our group, several of us had some history back even from the 60s and 70s of some racial tensions experience. And in some ways, it was a little disappointing to know that some of that's coming back around, but it seemed unfortunately familiar. I think things individually that people can do or are doing. One of our group members shared a story of just being nice to her neighbors and being friendly and making an effort to say hi. And I think that can go a long way. It doesn't matter if that's to a person of color or a person same color you are. But I think just, really taking the time to be friendly in this community is a good thing right now. as a community, I think one of the things that struck me in our conversation is that we need to do more than just stand by. We have to have difficult conversations. I think we've shied away from, those triggers that maybe you don't want to have difficult conversations, but now we really should, figure out ways that we can talk to people, and we might not always agree, but, ignoring it and pretending like it's not there just because it's uncomfortable is not something we can do right now. We talked a lot more than that, but those are the highlights.
Thank you. Thank you. Highlights are good right now. And again, any other detail, happy to take from you. Let's go to breakout room 2 and Becca and Neil. Are you there, Becca?
Sorry about that, guys.
That's all right.
So when we were first talked about our introduction to racism and where we felt like it was an interesting question for many of the people in our group, because they don't know that they know exactly when racism was something that was brought to their attention. And really what that meant for us is recognizing that our privilege has allowed us not to experience those situations. And so individually, it's maybe looking at how we can be more active in those conversations, whether it's reaching out to our own peers of color and kind of asking them, what do you need from us? Like, we're, perhaps giving them the mic rather than us always needing to tell them what they need, I suppose. And then from a community perspective, maybe immersing yourselves in those cultures, in those races, and maybe experiencing life from a point of view that maybe you haven't been able to experience because of the conditioning or bubble that you may or may not live in, and so, yeah, those are kind of the points we made.
Thank you. Thank you. Group number 3. Group number 2. Luann, if you could speak to group number 4's conversation.
Hi, yes. What we learned, an important thing is to listen. Everybody agreed that listening was very important. For individual action, this is a tough one, but one of our high school students said that it's very disturbing to hear in the hallway among her peers the use of the N-word very casually without regard for how it might land on somebody's ears. And somebody else who has children of color said, that really needs to be called out and reported. As individuals, we can call out racism where we hear it and we see it. That's a tough one to put on a teenager, but if we give them the tools, and one teacher in the group said that she really thinks that parents and families need guidance on how to have the conversations at home at every step of age and development. Help give us books, resources, whatever that we can do with our children and grandchildren in communities like this to make them more aware of how to be inclusive.
Excellent, excellent. Thank you very much, everybody from group number 4. Derek, can you speak to group number 5's conversation?
Absolutely. So for question 1, we actually realized that almost all of us in our group, we either experienced racism firsthand at some point in our lives growing up, or a couple of people in our group, they go through those times of the civil rights movement, and nowadays we're looking back and saying, hey, back then we're all fighting about this, and today we're still fighting about the same thing. So hey, this is time to make a change. And just having some of those conversations, we actually did identify the similar drive and passion we all have just to fight racism and systemic inequities. So at the individual level, we talked about different things. So one thing our group talked about, one of our members brought up is, so developing, like, you see how each organization has a mission statement. So having each individual develop their own mission statement, what they're about when it comes to racism and fighting inequities. So whenever people see you, they identify you like, hey, this is that person who doesn't, who doesn't compromise over XYZ values. And so we talked about just listening to people of color and their first-hand experiences to actually understand what's happening, give them the mic, and being curious to learn as well. At the community level, we talked about being intentional about our policies and how they affect others, and also just being accountable, holding each other accountable, holding ourselves accountable, and just elevating each other in that way. So I'm gonna wrap it up there in the interest of time.
Thank you very much, Derek and the whole group number 5. How about Ben in group number 6?
Yeah, we also had very similar gradual understanding of racism, either in the 60s or growing up. We learned today that the provisions put forth by the governor in policing, that Ottawa County has been doing a lot of that stuff already. So we were surprised to see that some of that work is already being done, and maybe we need to communicate that out better. As individuals, we felt like voting is probably one of the biggest things that we can do, but also like listening, respect, and then modeling that sort of anti-racist behavior, you know, calling things out, speaking in a way that is anti-racist. And as like a community, continuing these types of conversations and willing to be vulnerable and having these spaces, but then also recognizing that we are in a bubble and we have to recognize how we're perceived by the areas around us, because we look very different than what we think we are.
Okay, thank you. Thank you, Ben, and everybody in group 6. How about Lacey and group 7?
This group.
Yes, sir. Yeah, I can go ahead for group 7. So to sum up what we learned tonight, we realized that a lot of this work is data driven. So it's really, you know, a qualitative measure of measuring people's experiences and soul, and that takes time, but it's really important to do that, to define the impact that it's having in our community. At the individual level, it was a little bit harder. We had a great conversation just about the fact that we have to stay curious. We have to stay committed to this topic and continue to be vulnerable, which is probably very hard, especially at the individual level. And finally, as a community, in one point, there was a lot of great conversation, but community engagement is really led by leadership. So I think that, again, continuing these conversations and continuing to partner with communities of color to keep them engaged and learn and continue the conversation was really important. So again, great conversation, and in the sake of time, I'll wrap it up there.
Thank you. And thank you for everybody in group 7. How about Rhonda in group 9?
Sure, yeah, I'll just touch on a couple of the things, but in terms of what have you learned tonight, I think that what we learned, we primarily kind of centered around things that we learned from Steve Kemper and Jeff Hawk, and we were pleased to learn some of their policies, like not doing chokeholds and not teaching those things, not allowing those things, relieved about that. The fact that, you know, mental health is becoming a bigger part of police training, really, you know, relieved to hear just some of what we thought sounded like intentional language and denouncing the George Floyd incident. So I would say that, yeah, a little bit of good things came out of what we learned from the police departments, and we got to what can we do to bridge the gap regarding diversity, and just being very intentional about who you choose to expose your children to, being courageous in doing that and having to move out of your comfort zone and how hard that might be, but just having really intentional conversations for raising your children in a different way. And the second point regarding just being really intentional about supporting DEI and being conscious of the purchases that you make, including the media that you consume, the things that you read, everything. Just making really good choices about what you're supporting in those areas. And then we didn't get to the community question, but I would say that continuing to do more of these types of events that involve community leaders is probably a good start.
Okay, thank you. Thank you everyone from group 9. How about group 11, Jeff Hawk?
Hi, everyone. Just for group 11, first question, what have you learned tonight and how is that knowledge helpful? Amy thought that the local data presented, specifically from Derek, was very good. She learned a lot from that. Ben liked the 5 pillars that I talked about. What can we do as individuals to create more diversity in our own lives? One cool thing that Amy mentioned that she's doing personally, she works for the county. She's going to be doing some work with migrant employees. So she's brushing up on her Spanish so she can better communicate. So that's one thing, one cool thing that Amy's doing personally in her own life. And we were having a conversation about what to do as a community when we got pulled back in. So we never really got to that one.
Okay, all right. Yeah, not enough time for sure. Thank you, group 11. How about Julia and group 12?
Lots of the same things that have already been talked about. What have we learned tonight? Really acknowledging that we still have a lot of work to do, feeling good about the amount of people that showed up for this evening, and also stating that now is the time to do it. What can we do as individuals? Talked again, as others, a lot about being more intentional in our own actions and parenting our children, creating those opportunities, and absolutely talked a lot about more listening. What can we do as a community? I think one thing that Pat brought up that hasn't been mentioned, and that is taking a look at policies or laws that may need to be changed in order to make a difference. Specifically, we talked about the being able to recruit people of color and looking at the labor pool to make sure that it represents those that we serve in our community, and talked about building relationships. And I'm going to ask Jen real quick if you could come off, because we got caught off and she was talking about a book to read and we wanted to know the title of that book.
Oh, the book was called My Grandmother's Hands, and it's by Resmaa Menakem. He was recently interviewed on Being with Krista Tippett. So if you look on the On Being website, I'm sure you can find that episode.
Thank you.
Great. That's it. Thank you. Thank you, group, everybody in 12. How about Steve and group 14? Are you with us, Steve? Steve Kemker? I hear some clicking and popping. Is there somebody else that was in Steve's room?
Yeah, I can read what we had.
Thanks, Jenna.
We appreciated all the data that was given through the presentation. For the second question, we thought everyone should acknowledge that there are problems. And then for the last question, keep learning about people's experiences and getting to know, find commonalities with people.
Thank you. Thank you, group 14. How about Brett in group 16?
Yeah, okay. I think for us, real quickly, from an individual standpoint, we talked about the importance of trust and the fact that we can't individually just kind of show up once. We also touched just briefly on the issue of urgency versus importance. And if we pay attention to this issue only when there's a sense of urgency, we risk really doing another hurt, you know, if we drop the issue as the sense of urgency might fade. We've got to keep it important. So, you know, in terms of individually creating that desire to sustain the importance of this and to not just show up once. I think in terms of as a community, the interesting issue was the whole issue of fatigue, and especially fatigue for people of color. And that part of the reticence to talk is that they've been talking about this for a long time, people of color, and there's a fatigue there. And so it's creating a space where we can have conversations where we can validate the experience that people of color are having. We need to be able to engage in some validation, which we can't do in a dialogue that's, you know, sort of all people of privilege and all people of majority. Yeah.
Thank you. Thank you, Brett in group 16. How about Angela and group 17? We're almost to the end.
Yeah, my group had a really great conversation. The people in my group had good personal experiences and had a lot of passion around the topics. They really felt like personally it's important to speak up and to be willing to confront issues and to really avoid the Midwest nice that we're all so good at, and to say the hard things with courage and vulnerability. And they felt like as a community, if we could continue to have conversations with civil discourse, and if we could really continue to be looking at systems and how systems are continuing to support racism and hurting other marginalized communities. And they also talked about how having transparency and access to data is helpful as a community. They appreciated the data and wanted to be sure that that's available to everyone so that people can, you know, without emotion and without interpretation, just see what the numbers are saying.
Thank you. Thank you. Excellent. Thank you, group 17. Our last group is group 19, John Conroy.
Hey, everybody. We learned a lot, our little group. And one was that the striking imbalance in the percentages was not realized by our group in terms of effective COVID and that. I think more than anything, what I heard from our group was we need to listen to understand, not to respond. As individuals and as community, we can do and encourage. I just heard about my grandmother's hands. There's another book brought up called Wait for Fragility. One of the group members said, you have to touch your community. Go out and touch it. Volunteer. Go to these town hall meetings. Speak to people in charge of volunteer groups. Do TED Talks, podcasts, book clubs, iHeartRadio. Learn about diversity before you just start talking about it. And I think that was about it. And it was a great meeting. Thanks, Barbara, for all you do.
Right, thank you. Thank all of the participants and facilitators. I do have a couple other polling questions that I want to ask. I'm going to put up right now. And the first one is just a quick evaluation question. How was this town hall helpful or not? Was it helpful or was it not helpful? Did it make you more aware? Has it motivated action? Has it convinced you to continue as a leader or an advocate? And again, you can choose more than one here. We got 88%. That seems to be pretty typical, that this 88% thing. Oh, 90%. Okay, I'm gonna give it another minute. Well, not a whole minute. All right, I'm ending that polling and sharing the results. So one person did not find it helpful, and I'm sorry. I hope that that person will engage me and we can talk about what might have been more helpful. 41% said made more aware, 26% motivated to action, and 57% said it convinced us to become or continue as a leader or an advocate. The next one is about a future town hall. So first, would you be interested in participating in additional town hall meetings on public health and racial justice? And if so, which topics would you like to see addressed? And again, multiple choice. So the first one's just yes or no. And then if you are interested, there's organizations addressing racism, historical instances of racism, personal stories from people of color, local government actions and reactions, local businesses and the economics of race, the education system, white privilege specifically, a deeper dive into healthcare, a deeper dive into mental health. We're at about 50%, so I'm gonna give this a few more seconds. And this will very specifically help inform the direction of our next few town halls in the series. So your feedback is really critical. And climbing up, we're at 94%. I'm going to end the polling and share the results. So the good news is 100% of people who answered said that they would participate again. And the highest rate here is organizations addressing racism, which is excellent. I think we've started reaching out to some of those and asking them to participate, and so we'll continue that. The last one is about what kind of action you're willing to do. And that doesn't need to be because you sat here, but just what action are you willing to take now? And again, you can answer as many of these as you want. Some of these came up as suggestions for individuals and for us to work on expanding our own interaction and expanding the diversity and inclusion in our own lives. So there's reading and listening, there's engaging in conversation about race and racism, and then there's engaging in conversations with people who are not the same race as me. Participating in protests, attending or speaking, being a panelist at a town hall, attending implicit bias training, getting involved in local government like the Human Relations Commission, donating to a group, and participating in cultural immersion experiences. And as we go along, we'll share more information on many of these that might seem a little vague right now, like cultural immersion experiences. We'll share more of that information. We have 48 out of 50, so I'm gonna share this. Looks like 94% of people are ready to engage in more conversations, which is wonderful, and nobody said that they aren't going to do anything. So thank you. I'm hoping that Jessica is taking the screenshots for me so that we can capture this. And I'm going to close the polling down. I want to remind you of next steps. This has all been recorded, and so we'll send this with slides, with materials that have been brought up and shared, with a chat conversation, and we'll package all of that and get that to you. We'll also be sending the unanswered questions that were in the chat box to our panelists and asking them to give us a very quick turnaround because ideally we want to have all of this out by the end of the week. And then, as I said, tomorrow, the HRC, Loudoun Library, and the Mental Illness Task Force is meeting to debrief this whole conversation and all of the feedback we've received so far. Please feel free to reach out and provide more feedback in whatever aspect you want. My email's barbara@momentumcentergh.org. I would love to hear from you, so don't hesitate to do that. We have designated July 13th for our next town hall. Our working title is Initiating a Response, kind of that request to hear from people working in these areas. But the panel has not been all confirmed yet. Some have, some haven't. So we, again, will get that out ASAP, but we were holding off to get feedback from this group tonight. But mark your calendar now for July 13th, 6:30 to 8:30. We will send an invitation to everybody who participated. So we'll remind you to register. And we also will have QPR training again from 5 to 6. So if you haven't done QPR, that's the suicide prevention training. It takes 1 hour. A Mosaic will be offering that training that same night. Big thanks to the Human Relations Commission at Grand Haven, Loudoun Library. Huge thanks to our panelists and all of our facilitators. So Julia, Derek, Steve, Jeff, Brett, thank you so much. Our facilitators from the Mental Illness Task Force, from the Momentum Center, from the HRC, and from Loudoun Library. We could not do this without you. As you can see, this is juggling a lot of people. I appreciate your patience and your grace with me and with technology. And until next time, the divine in me recognizes and bows to the divine in you. Namaste.
Thank you, Barbara. Thanks everyone for attending.
Thank you, Derek. I'm going to hold it open for a little while I look at these chat boxes, but formally we're done. So feel free to check out and stay around if you want.